My name is Randy Bigley. Joining me on the podcast is Brad DeCamp from ADAMH, actually, right? You're the ADAMH Director.
Yes, I am. Good to see you, Randy.
Good to see you too. And how long has it been now you've been the Director?
Believe it or not, I've actually been at the board for a little bit over 6 years now. Been Director for a little bit over 5.
Wow, it's been that long already. I remember when you became Director.
Yeah, absolutely.
Yeah.
It's been an interesting ride. We've certainly had some things come up with the pandemic that have been challenging, and some other things along the way. But I believe I'm where I need to be.
Now, a lot of people probably heard of ADAMH. What does that mean? What's that stand for?
Absolutely. So ADAMH stands for Alcohol, Drug Addiction, and Mental Health. And we are a special district that focuses on specifically alcohol, drug addiction, and mental health services. And what that means is we are the planning authority for Crawford and Marion counties when it comes to assessing what the community needs, and trying to figure out what services would best meet those needs, and working with the resources that we have, both from our local levies and then from the state and federal resources, to try to provide the closest match between the services we have and the demands that the area has.
What kind of services do you have there?
We provide everything from outpatient to full-blown inpatient services. Not all of them are local, but most of them are. For example, we do case management, assessment, individual and group counseling, medication-assisted treatment, medication management for mental health. And then on the inpatient side, we were able to do detox and also inpatient mental health services with some contracts that we have with providers in both the Cleveland and Columbus area.
And you serve both Marion and Crawford County, correct?
That's correct. We actually have offices in both counties. We're kind of taking a look at our office in Marion and what we might be able to do to repurpose that actually for more services for housing for individuals with serious mental illness. But that's kind of a project that's underway and in consideration for what we might do there.
It's too bad about mental illness. It's not, and I consider it as any kind of, I don't use the word handicap, I don't use that anymore, but any kind of an issue. I mean, even you can compare it to a physical issue, but people don't consider mental health that way, do they? Lots of times.
No, but I think what you're hitting on is something that I did want to touch on, and that is, I think where we're heading in the future is looking at how can we better integrate mental health with primary care. Because one of the challenges that we've seen over the years is we really have really significant workforce issues, and I think that's hit everybody, especially with the pandemic. But even before the pandemic, our behavioral health workforce in our part of the world was really not as robust as what I would have liked to have seen. But I think there is a way that we might be able to partner either with federally qualified health centers or primary care docs to really think about what are some ways that we can leverage the resources that our system has with those that the primary care system has to really begin to talk about those issues. The mind and the body aren't separate. They are together. And so how can we begin to start to think about primary care maybe as a way for more people to come into our system and then make referrals or provide other support services to the healthcare system.
How has the pandemic affected you guys out there?
I have to tell you, Randy, our providers have done a yeoman's job of transitioning to providing services via video and telephone. That was something that we did not do a lot of. We had the ability to do it, but not a lot of providers wanted to do it because there's a certain thought of being able to have someone in front of you or in the room with you and kind of judge body language and things like that. But I got to tell you, they did a really nice job of making that transition. It's a lot harder to do services over video and phone than it is in person. And if you think about it, the vast majority of the training that people go through is interpersonal. It's like you and I sitting here across the table from each other. That's the training.
Sure.
You don't get the training on the video.
Right.
So now all of a sudden, guess what? You can't be seen. You can't be in the same room together safely for at least a period of time. And so they had to really make an adjustment. And we had the support of the government, at least at the state level and the federal level too, to do services and actually maintain reimbursement for those services, because that's key. Even though we pride ourselves in being available for people, but there is that reimbursement question that does have to be addressed. So we had the support there. But I think that's been the big thing. We've transitioned back to more in-person services now, but there are still some people who would prefer to be seen via video. Right. So I think that's going to continue.
Yeah, I was going to say if that's an option that's still be available after this is all done.
Absolutely, and it's something that maybe it creates an avenue for somebody to get help who might not otherwise.
Sure.
So,
right.
So, yeah.
They may not feel comfortable being in the same room, but they'll do it over video, right?
Exactly.
Yeah.
Exactly. Yeah.
Yeah, I think the pandemic's changed a lot of the ways we do things. Forever. I think things have changed forever that way in some ways.
I do, and I think we're going to be seeing, unfortunately, some of the downsides of the pandemic from the stress, especially with the kids. that's one of the things that
Yeah.
I'm most concerned with. I mean, if you think about what happened with schools,
Sure.
with the shutdown and going to virtual learning, and that was something that, again, it seems like you ought to be able to learn virtually the same way that you learn in the classroom, but that's not necessarily the case.
Right.
And so I think the starts and the stops and some of the stress that was, being put on through different thoughts about masking, not masking, I think that had a cumulative effect on our school-age kids, and I'm concerned that that's gonna continue for some time. So what we're trying to think about is what are the things that we can do to intervene earlier with kids as they become identified either through the school or the resources, and really begin to think about what are some services that we can try to provide that can minimize that impact.
Do you guys work with schools quite often?
We do. Actually, we had a meeting with the Cyrus City Schools just last week, and some of the really committed personnel there, I would say, they're very dedicated and committed folks and want to see what's best for the kids, and they're frustrated, I think, with some of the things that they have to deal with and the things that they see, and so what we're trying to do is come up with a way that we can really begin to communicate maybe in a better way.
Yeah.
Not that it's bad, but just in a way that might be able to recognize some of those issues that you and I were touching on earlier.
I think even more today, especially teenagers, I mean, they really have a lot of, more than you and I had with social media and all that and stuff too. And I that's probably, you probably get to see a lot of effects from that too, don't you?
Absolutely, and,
Yeah.
and we have a program that we've been providing here in Crawford County around, that looks at those things like, the cyberbullying and things like that, and some of the other things that kids get involved in, and it's all very challenging, and like you said, it's not as simple as, not that we had simple lives, maybe back in the day, but it was very different, and you think about the standardized testing and the things that the schools are under pressure, and the kids, and you have to figure out when you're 16 and 17 what you want to do for the rest of your life.
Right.
I'm 51, almost 52, I've still not figured that part out.
Me either.
So the kids today are very advanced, Randy. They're, they've got it all figured out, but you're right. I mean, there's the technology is a great thing, but it also comes with risks.
So you see all ages there, don't you?
Yes, we do.
Yeah. From kids to up to probably elderly too. So
we do, and that's been one of the concerns with the pandemic is around suicide prevention, because certainly we do programming in the schools and we want to identify kids as early as we can, but one of the other things we see is, I think through the pandemic and the loss of employment and maybe livelihood, that's affected some of the older folks too, in terms of people who are well advanced in their career or even older, who may have lost their life savings or their home or something like that. So we do try to be as available as we can be. We have reached out through the Farm Bureau to our agricultural community here in Crawford County, which is obviously a very significant part of our lives, and we want to make sure that we're supporting them. And I would say we'll probably be reaching back out to them again as well, as I think that was pre-pandemic when that occurred, but that's another community that we want to try to support as best we can.
Right. Anything else you want to cover that we haven't covered yet then?
We want to continue to focus on prevention services. That's something that we will continue to fund and provide on both the mental health and also the SUD, the substance use disorder side. And we'll continue to do that. We want to work with our partners as closely as we can. I do also want to say a shout out to my board members and our staff. We've got a very dedicated group of 14 volunteer members between the two counties that don't get paid a dime to come, and they're very concerned and also very dedicated to providing services. And as a director, I wouldn't be where I am without my staff. They're very dedicated people, and they put up with me and my idiosyncrasies.
There you go. If someone wants to get a hold of ADAMH, how can they do that?
The best place to get us is to call 419-562-7288. We do also have a website at mcadamh.com. We've just updated that in the last year, and we'll probably be doing another update to that as well. We also have, if someone is in crisis and needs help, they can reach the crisis text line by texting the number 4 and the word HOPE to 741-741. We have our Pathways line, which is 1-800-544-1601, and then we also have Contact Crawford County, which is 562-9010.
All right. Brad, thank you so much for coming in today.
Thank you, Randy. Always good to see you.
Same here.